Your legs locking up at night? It's not just aging, it's a warning sign your muscles are starving. And the cause may not be what you think. Most people blame low potassium or dehydration, but new science points to one missing vitamin. And what happens inside your muscles might surprise you. The next one? Almost no one talks about it. After 60, leg cramps don't just come from nowhere, they come from deeper imbalances. You might wake up with tight calves, feel unsteady getting out of bed, or struggle to walk upstairs without pain. These aren't just signs of aging. They're early warnings that your muscles are missing the nutrients they once relied on. And in this video, I'll walk you through 3 essential vitamins, backed by clinical research, that help restore strength, prevent nighttime cramps, and protect your independence. Always check with your doctor before starting any new supplements. 1. Vitamin D, the muscle strength guardian. Most people think of vitamin D as the bone strength vitamin, but what they don't realize is that your leg muscles depend on it just as much, especially the ones that keep you from falling. Now, here's the problem after 60. Your skin produces way less vitamin D from sunlight, and your kidneys, they become slower at converting it into its active form, the kind your muscles can actually use. Even if you get outside or take a multivitamin, your muscles could still be starving for the real thing. Let me explain why this matters. Inside every muscle fiber, there are tiny receptors. Think of them like light switches, waiting to be turned on. Vitamin D is the one that flips those switches. Without it, your body doesn't know how to build muscle efficiently. And the first to suffer? The fast twitch fibers in your legs, the ones that help you stand up, take stairs, or catch yourself when you stumble. These are the fibers that quietly shrink with age, and without enough vitamin D, they vanish even faster. That's when cramps start. Weakness creeps in, and falls happen, often out of nowhere. In fact, a recent study in Frontiers in Nutrition followed older adults taking daily vitamin D. They found a significant improvement in leg strength, especially on the left side, just from consistent supplementation. And here's what I tell my own patients. Take 2,000 IU of vitamin D3 once a day in the morning, but don't take it on an empty stomach. Pair it with healthy fat, like eggs, avocado, or olive oil, so your body actually absorbs it. Frank, one of my patients, is 72. He used to wake up every night with cramps in his toes and calves so painful, he had to walk them off. After just 2 weeks of taking vitamin D in the morning with breakfast. He told me, "Doc, I slept through the night for the first time in months." But here's the part that really mattered to him. He was finally able to walk uphill to the post office, something he hadn't done in nearly a year. And the reason wasn't just strength, it was nerve connection. Because there's one vitamin that keeps your muscle signals firing clean and clear. And that's exactly what we'll look at next. 2. Vitamin B12, the nerve signal. Protector. Frank didn't just regain strength, he regained control. But what most people miss is that muscles don't move on their own. They wait for a signal. And if that signal doesn't arrive, the muscle just sits there, limpio, unresponsive. That's where vitamin B12 comes in. You can think of B12 like the insulation around electrical wires. It wraps around your nerves, protects the current, and makes sure messages actually reach the muscles. Without it, that signal gets scrambled, and your legs, no matter how strong, stop listening. Here's what most seniors don't realize. After 60, your stomach produces less acid. And without enough acid, you can't absorb B12 from food, even if you eat healthy. That means you could be B12 deficient right now and not even know it. Let me give you a real story. Joan, 68, came to me complaining about clumsiness. Not pain, not weakness, just small things. Bumping into doorways, missing a step, dropping her keys. Her blood work showed low normal B12, but functionally, her nerves were fraying. We started her on a 100 microgram sublingual B12 under the tongue every morning. After 3 weeks, she said, "I don't feel electric shocks in my calves anymore. I didn't even know that was abnormal." A 2024 study in Aging and Disease backs this up. Seniors who took B12 daily for just 3 months had significant gains in muscle quality and strength, even without changing their workouts. So, how do you apply this? Choose methylcobalamin or cyanocobalamin in dissolvable tablet form. Take it in the morning, ideally before breakfast, or 30 minutes after. If your digestion's weak, and it likely is after 60, under the tongue is best. And don't wait for full-blown symptoms. B12 issues show up subtly. Tingling feet, loss of balance, weak grip, twitchy calves at night. Gentle viewer, prompt. Have you ever felt your legs twitch or tingle, even when you're resting? It may not be circulation. It might be a nerve signal trying to push through. And coming up, there's one more piece to this puzzle. Even if your muscles and nerves are working, there's something else that can throw everything off. Calcium. Too much in the wrong place. Too little where you need it. Let me show you the vitamin that knows exactly where calcium belongs. 3. Vitamin K. 2. The calcium traffic controller. So now your muscles are strong, your nerves are firing again. But what if the real problem is the traffic? Because in the body, calcium is traffic. It's supposed to flow to your bones and muscles, not pile up in your arteries. But as we age, that system gets confused. Calcium starts parking where it shouldn't, in blood vessels, joints, even muscle tissue itself. And when that happens, circulation slows, cramping increases, and muscles start seizing instead of stretching. That's where vitamin K2 steps in. You can think of K2 like a traffic cop. Its job is to redirect calcium out of soft tissue and send it where it belongs, your bones and working muscles. One of the main ways it does that is by activating a protein called MGP, matrix GLA protein. MGP tells calcium, keep moving. Don't harden here. Now, here's what this means for your legs. Better circulation, less tension, fewer night cramps, and most importantly, better recovery after movement. In fact, a 2024 study published in JAMA Internal Medicine tested K2 on seniors with chronic night cramps. After just 8 weeks, the group taking K2 had a 63% reduction in weekly cramp episodes, while the placebo group actually got worse. That's a big deal. And it's not just about cramps. K2 also helps calm inflammation, especially one marker called IL-6, which goes up with age and makes your muscles feel stiff, achy, or swollen after walking. I had a caregiver named Denise write to me. Her father, 79, had been waking up at night from what he called Charlie horse attacks. They tried hydration, stretching, nothing worked. Once they added 180 micrograms of K2 at lunch every day, in the MK7 form, things changed fast. She said, he didn't just stop cramping, he started walking farther without fear. If you take calcium or vitamin D, K2 becomes even more essential. It's the piece that tells your body where to put those nutrients. So don't let calcium pile up in the wrong places. Let K2 guide it to your strength, not your stiffness. Now, you've just learned the 3 vitamins that support your muscles, nerves, and calcium flow. But knowledge is only part of the journey, because healing isn't just about what you take. It's about what you begin to believe again. Let's talk about that in a moment. If your legs have been quietly getting weaker, if you've been waking up with cramps or needing the wall just to stand up, it's not your fault. And it's not just age. It's your body asking for something, a signal, a connection, a missing message. Because strength isn't just about pushing harder. It's about giving your body what it's been asking for and listening in time. You don't need to become a health expert. You just need to remember, muscles need D, Nerves need B12, and strength needs direction. That's K2. Frank didn't expect much from a morning pill. Joan thought she was just clumsy. Denise thought her father was just getting old. But small things shift when the body feels safe again. And sometimes, that starts with one simple change to your routine. Because the goal isn't just to stop cramping. It's to walk across the room without holding onto the counter. It's to bend down to pick up your grandchild and not worry if you'll get back up. If this video spoke to you, leave a comment below. I'd love to hear which part connected most. And if you want more healing science like this, don't forget to subscribe. We've got new videos each week. Always calm, always clear, always for you. Take care of your legs. They carry more than just your weight. They carry your freedom.